Do you think that there should be a mask mandate?
That's a tough question.
Yes.
Yeah.
Yes.
Okay.
I think that it should be based on science, and if COVID rates rise above a certain level, then there should be.
So thank you so much for being with us. And today I'm really excited and happy to have with us Lindsay Hammes, who is the Director of Vaccine Communications for the CDC here in Maine, and a very busy job. And I know you have lots on your plate. So I really appreciate you taking some time to be with us. Thanks so much.
Very happy to be here. Thanks for having me on.
Great. I know that this week has been, there's a lot of information out there. Here's the part that is hard for people. So Maine is doing a great job in terms of high vaccination rates. We are getting lots of folks vaccinated. We're, pretty high compliance rate, I think, with, social distancing and masking. And yet we still have one of the highest hospitalization rates and transmission rates in the country. So how can both of those things be true? I think that's where people are. It's like, wait a minute, how is this possible?
Yeah, I think so. I think, like you said, we're at a place that's it's great because we're one of the most vaccinated states in the country and one of the most vaccinated countries in the world. And in total, 907,255 total Mainers have been vaccinated, fully vaccinated, of our entire population. That's according to the US CDC data as of Monday, the 20th. That's great news, right? But there are still more of us out here, Mainers, who are not vaccinated, and it's sort of creating a bit of a picture of two Maines. And so, I guess what I would say here is for those who are unvaccinated, the Delta variant is just, it's a bear, right? It's hard to put too fine a point on how dangerous this is, how transmissible it is, how kind of wily and
severe,
exactly, how it will latch on to sort of any available opportunity to infect. And so we're seeing rates of community transmission across Maine and across the country that are making people sicker and ultimately landing people in the hospitals and then in ICUs, on ventilators. And you're right, we're at a point where we're hitting records that nobody wants to be hitting, unfortunately.
Yeah. So I think, so for so many people, it was, at first we were worried, and like the first wave, if we can call it a wave, we were worried and sort of almost scared into submission. And I think people felt like, okay, now, we're gonna do all the things right, and we're gonna, do it, and then summer. And now I think people we're facing the winter, and potentially, more isolation and more, being really careful and stuff. And so we did some talking to people on the streets, and I'm happy to say that most of the people we talked to, I think almost everybody we talked to, and they were random, supported the wearing masks, supported vaccinations, did all of that. But there was one gentleman who worried that, he said, I'm vaccinated.
I think if you're vaccinated and you can show proof of vaccination, that you shouldn't have to be obligated to wear a mask. I went to a school conference last night, and they required masks, and I kind of felt like I didn't want to wear one, but I was forced to wear one, and I didn't want to wear it.
So what would you say to that?
Yeah, I guess I would say, I know it's frustrating. And we know that kind of at the beginning of the summer, everybody heard, get vaccinated, and this is your opportunity to throw the masks away. And I guess I would come back to the Delta variant. The Delta variant has changed everything, unfortunately. And what I will say is that being vaccinated still means that you are at just such an exponentially smaller risk of becoming infected with COVID. And so you are safer in that sense. And we thank you for getting tested, and we thank you for wearing masks and things. At the moment, Maine doesn't at the state level have a mask mandate in place. So mask mandates are, the purview of local businesses and schools. Of course, our strong recommendation, particularly in schools, is that everybody wears a mask no matter what, no matter when, no matter what your vaccination status. But and the recommendation from the US CDC and our guidelines that we're sort of following, their guidelines that we're following, are also that if you're out about in public in an indoor place, we also recommend that you wear a mask for your safety and for others. But we know that the virus spreads more easily inside, and that's why we ask just to use every sort of tool that we have in our tool belt to try and protect yourself and others who either may not yet be vaccinated or who can't yet be vaccinated, right? Thinking of kids who aren't yet eligible.
Wow. Well, and I think that's what I feel is like, you're not doing this for you, you're doing this for other people. So, let's talk a little bit about other variants. So now, of course, on the news and in the COVID world, we're hearing about new variants. And so talk a little bit, Lindsay, about how that happens and why having more vaccinated people helps us resist new variants.
Sure, I'm happy to talk about that. I will preface this by saying I am not an epidemiologist. I'm not a scientist. I'm a communications professional. But what we know there is that, by being vaccinated, you're sort of putting up your wall of defense. And it means that the virus can't take hold, mutate, and then move on to somebody else. Or if it does take hold, it doesn't have a good foothold, if you will. And so you're making it harder and harder for the for the virus to find a way to change, evolve, mutate, become something different. I will say at this point, across the nation and according to our sort of genome sequencing, we're still seeing that the Delta variant is responsible for about 99% of the virus that we're seeing, certainly in Maine, but across the country at the moment. There are other variants that the media are talking about. I think we've heard about the Mu variant and the Lambda variant, and there could be others as well in the future. But by getting vaccinated, you're sort of putting up you're putting a roadblock in the way of transmission. And so the more people that we have vaccinated, the greater number of roadblocks. And eventually, the idea is that if more people are vaccinated, the virus doesn't have anywhere to go where it can then mutate and turn into something that we, don't know how to protect ourselves from.
So let's talk a minute about the vaccination for kids. How optimistic are you that we're going to have access to it and that Maine kids are going to get access to it? How are you feeling about that? And in news you can tell us?
I wish I did have news I could share. I don't, we're waiting from the federal authorities. Obviously, we know that Pfizer has just given their data to the FDA. And so it will take them, I think it's typically 5 to 10 weeks, maybe a little bit longer even potentially, to do the scientific review that's needed for that, to make sure that the vaccines are safe for kids and the dose that's been given, that they are effective at preventing or helping to prevent disease. And so we're waiting for the science to tell us what to do on that front. And, the Moderna vaccine will be, I assume, shortly sort of on the heels of Pfizer and J&J there again after that. We are eagerly awaiting those results as soon as the FDA and the US CDC have their sort of ducks in a row and feel comfortable. They'll make their recommendations. When that happens, Maine CDC is, ready to run. We are confident that there will be vaccine in the state for kids. We're working already with providers and, pharmacies and provider offices and pediatricians to make sure that we're getting a plan in place so that when that ruling comes down, that it is safe and effective for children, and we expect that it will, that we're ready to start vaccinating right away.
All right, that's very welcome news. So reading about what's going on in Europe, and again, in the attempt to help us get back to normal, we are relying a lot on a lot of the instant tests, the antigen tests, that you can buy in a drugstore, and the government has subsidized those so that, as I understand it, you can correct me if I'm wrong, that tells you if you're contagious at that moment.
Yeah, so I think we definitely have antigen testing here in Maine. For a while, it was sort of the testing that's been most broadly available, and we're working to make sure that that continues across the state. There is a nationwide shortage of materials for those tests, and so we are impacted by that just as the rest of the states are. But we do find that that is a helpful tool to be able to, within, usually the results come back within 15 minutes or a couple hours, depending. But that is a helpful tool to make sure that people are safe and able to go about their days and engaging in activities that they would normally engage in. I would say that they are not always 100%. And so that's why we ask also, certainly people to get vaccinated if they haven't been vaccinated, but also to wear masks if they're going into public places or if they're going to be interacting with vulnerable populations in particular. And then there's always, the hand washing and distancing, which are never bad public health measures.
Good for everything. Yeah. Oh, good. Awesome. Okay. So the last question I have for you, Lindsay, is if there's one thing that you would want people to know from the CDC at this moment.
That I know everybody had hoped at this point that we were going to be through this, and we're as bummed out as everybody, but we're also working really hard to make sure that we can make Maine people safe. And so we ask you to remember that the vaccine doesn't care where you live. It doesn't care what religion you are, what box you tick off in the voting booth. It really is widely and opportunistic, and in that sense, an equal opportunity destroyer, if you will, instead of equal opportunity employer. And so do the things that you can do to keep yourself safe, to keep your family safe, to keep your friends, your kids, your loved ones, your community safe. And that is get vaccinated if you haven't been vaccinated, or if you're able to have a conversation with someone who's close to you. We're not going to argue our way out of this pandemic, but having conversations and listening to people's concerns and sharing your experiences, I think, can be a useful tool to move people who are still perhaps hesitant along the spectrum. And the more that we can get Mainers vaccinated, the sooner we will be through this.
Awesome. Well, thank you so much. Thank you for being with us today, Lindsay. And again, thank you so much for the work that you do every single day. And everybody at the CDC, we know you are working overtime. And as hard as this is for all of us, I can't imagine what it's like for all of you. So thank you for what you're doing for me. We appreciate you.
Thank you, Betsy. And thank you for all you're doing to bring this information to Maine people.